Hello my friends, this is Dr. Bingham again from Intermountain Pet Hospital, and I'm here today to talk about this week's segment of the question of the week. The question of the week this week with the dental focus is my dog too old for dental cleaning? That's a question that we get all the time, simply because a lot of our anesthetic patients or dental patients are older just by the nature of the disease. So one of the questions we get a lot is my dog too old for an anesthetic procedure or dental cleaning? And the answer is, age is not necessarily an anesthetic risk, poor health is. Okay, so we don't really consider any dog to be too old for an anesthetic procedure or dental procedure, but we look more at their general health. And when I say their general health, if the liver is fine, if it's functioning fine, and the kidney is fine, functioning fine, and more importantly the heart is functioning fine, but if all of the organs, lungs, and everything are functioning fine, then anesthesia is a very low risk regardless of the age of the patient. Now I will say this, the older patients do recover a little bit slower. If we put a 1-year-old dog under anesthesia, they're usually bouncing around within even a couple of hours of anesthesia, acting like nothing happened. But the older they are, the slower they recover. It might be later that day or maybe even the next day before they're feeling back to normal. So they do recover a little bit slower. But as far as safety goes, as long as the organs are functioning fine, the risk is very minimal. Age is really not a factor. We look more at health than age. Another thing that I'll say is we're really good with anesthesia in older patients, and the reason why is most of our anesthetic patients, our dental patients, are older dogs. By nature, most of those older dogs have more dental disease and or they have lumps and bumps that need to be removed. The younger dogs generally have healthier teeth and less masses that need to be removed. So as they get older, they have more problems. So most of our anesthetic patients are older patients. So we're really good at doing it, which also decreases the risk. You know, the more we do it, the better we are at it, the risk is less. Another thing that I want to point out is dentistry is almost even more important to do in an older patient, simply because dental disease is a health risk for the organs. You know, dental disease, periodontal disease, infections in the mouth are hard on the liver and the kidneys and the heart. So to leave dental disease untreated, you're leaving those older organs at a disadvantage fighting that infection. So in older patients, it's almost more important to keep the mouth healthy, because then you can kind of help out those organs as they get older to stay healthier and live longer and better lives. So it's almost even more important with older patients. And we do it quite a bit, which means the anesthetic risk is low, simply because we're much better at it. Hope that answers the question. So in summary, anesthetic risk is not necessarily an age-related issue, but a health issue. And as long as general health is good, we have no problem putting an older patient under anesthesia. We're just very careful about it, and we do a good job. Hopefully that answers the question.